Welcome, everyone. This is our fourth and final session of the Building Healthy Strong Communities virtual conference. Just giving everybody a chance to file in. I know it takes a minute to get into the webinar, but while folks are joining, I'm just going to touch on a few housekeeping notes. So if you are here to receive CEUs, this session is approved for 1.5 CEUs, and you are required to stay for the full duration of the webinar. So we'll be here for an hour and a half, and you need to stay for the full time to get your 1.5 CEUs. We will not provide partial credit. You will also see polls coming up throughout the webinar. Please respond to those polls. Those are required to receive your CEUs. If the poll is not working for you, feel free to use the chat. Liz will be taking questions throughout the webinar, so continue to put questions in the chat and the Q&A box, and we will take a few breaks during the webinar to respond to questions. Before we pass things on, I'm going to launch just a couple polls so you guys can get used to responding to the polls, as well as we can figure out who's in the audience today. So here comes your first one. Again, if the poll isn't working for you, just go ahead and put your response in the chat. Give everyone a few more seconds. All right, and it looks like we have mostly alumni here today. No surprise there. This is widely promoted to our alumni base, and we're glad to have you guys here. Okay, so moving on to poll number 2. And while you guys are responding to that poll, I just want to remind you that we do have our closing reception today, Connections and Conversation, happening from 4 to 5 p.m. It's a great opportunity to meet other alumni, friends of the school, as well as some of our presenters that participated in our virtual conference. It's 1 hour. We'll be breaking out into breakout rooms to discuss the topics that we went over these past couple days. I will put the registration link in the chat when we are all finished. All right, just a couple more seconds. All right, and we have quite a few practitioners here today. That's awesome. Okay, so I'm now going to pass things on to Summer Berman. She is a member of the Alumni Board of Governors, as well as the chair of the Professional Development Committee, who assists me in planning this event every year. So Summer, the floor is yours.
Thanks, Emma. As Emma said, my name is Summer Berman, and I'm the director of Fresh Start Clubhouse in Ann Arbor, and also, as she said, a member of the Alumni Board of Governors and chair of the Professional Development Committee, which brings you this conference every year, the Building Healthy Strong Communities Conference. I'm pleased today to introduce today's speaker, Elizabeth Gonzalez. Liz is a licensed clinical social worker working in the intersection of social work and education. In 2017, she founded a group private practice called Amplify Collectivo, a collective of therapists of color that provides culturally sensitive mental health services and also serves as the education and training program manager at U of M's Spectrum Center. Liz uses a holistic health lens in her work that emphasizes the inseparable connection between our health, mental health, and the environment. Please join me in welcoming this afternoon's Building Healthy Strong Communities virtual conference presenter, Elizabeth Gonzalez.
All right, thanks, Summer, for that welcome and intro. I'm going to share my screen here. All right, is everyone able to see my screen okay? All right, okay, so okay, cool. Thank you, Jennifer. Okay, so here's one of the things. Because this is a webinar, I can't see all of your beautiful faces. And as someone on the Myers-Briggs who is between introvert and extrovert, but more on the extrovert side, I do get energized by seeing all of your faces, but I won't be able to do that today. So the next best thing is engagement via the chat. So throughout our time today, I'm going to be throwing out a lot of questions. At some point, we're going to look at a couple of case studies. And so all of that will be processing out loud via chat. And so, you know, one of the things I say that I have is my ADHD superpower of being able to like multitask and like pay attention to the chat and also continue to chat. So here's my screen. I've got two screens. So, all right. So here's what we're up to today. I think it was last May that I presented on teletherapy and how to get started. So today is going to be a recap of that, but we're going to go a little bit more into ethics. So again, we'll just use the chat feature. And then just to say a little bit more about me. So Randy's asking how many credits count for ethics. Oh, that's a good question. Maybe Emma could throw that out there in the chat. So Elizabeth Gonzalez, that's my name, pronouns she or they, I go by Liz. So as Summer mentioned, I work at the Spectrum Center. I do some adjunct lecturing at the School of Social Work. And then I also run a group practice in town. I've previously worked in college access nonprofits, in community mental health, in college counseling centers, and at the National Domestic Violence Hotline. Okay, so here is a poll, our first poll, and I think Emma's gonna pop that onto our screen. Yep, so first question here.
Give you guys just a couple more seconds, and I am asking our CE office the question about our ethics credits for this course, so sit tight. Are you able to see the results, Liz?
Yep, so 88% social workers, 2% other mental behavioral health professionals, other health professionals, and none of the above. Okay, awesome. Well, welcome everyone. I'm so glad that you're here. And here's what we're up to. Okay. All right, I'm just reading through the chat. Okay. All right, so here's what we're up to today. So as I mentioned, I did this, wow, I think this time last year, maybe it was more in April. So we're gonna go over some of the things to get it started. Perhaps many of us have already been doing teletherapy, so the next section is really gonna be a recap. But I do have questions about what it's been like for you, what kind of platforms you all have been using. We'll talk about HIPAA, we'll talk about the code of ethics, some of the things that you'll be leaving today having a better sense of is being able to describe the benefits of teletherapy, the legal issues related to teletherapy, ethical challenges associated with providing teletherapy, and different types of competencies necessary to practice telemental health effectively. Okay. Retired social worker, okay. All right, so in 1992, Time magazine published an article about telemedicine. And I think that this was one of the first articles published about telemedicine. And the main caption of it was healing by wire. And when we think about that, that is exactly what we have been up to, providing teletherapy services, right? We're providing access to folks maybe who wouldn't have had access to therapy before teletherapy became everything and pretty much our only mode of providing therapy at this point during COVID. So I'm curious, how many of you did teletherapy before this last year? And you could just throw that in the chat. Wow. So this is, so this last year of teletherapy is new for many, many of us, I see. Yeah. So when I went into private practice in November of 2016, a few months before, I learned about a directory that was a new directory called the National Queer and Trans Therapist of Color Network directory that was founded out of San Francisco. And so I learned about this directory and I put my name on there, and as part of filling out the profile to be on this directory, it asked if you would provide teletherapy. And so I just said yes. I hadn't done it before, but I just said yes. And so when I went into private practice in November of 2016, I want to say by January, I had two clients outside of Ann Arbor. I'm in Ann Arbor, Michigan, outside of Ann Arbor, reach out to me because they found my name on this directory. So one of the cool things that teletherapy has enabled me to do is to provide access to, again, to folks who may not have had access before, folks who were looking for a therapist that shared some aspects of identity. And so that's how I really got started with teletherapy back in 2016. Yes. Okay, so we're going to keep it moving here. So again, this next part is really going to be a review of what I've done in the past. Not sure if any of you caught that webinar back in last year in April, I think it was April. So what I'm going to start off with is another poll. And so I know Emma will put that out there, but what aspects of teletherapy do you find the most daunting? So perhaps even a year in. And if none of these apply, feel free to throw in the chat. Jennifer, you asked what was the name of the source. Are you asking about the name of the directory that I am on? Okay, cool. Let me type that in there. It's a National Queer and Trans Therapist of Color Network. So clients having a private space. Okay. All right, let's check out these results and then I'll come back to the chat. So managing technology with clients and patients. Yep. Understanding the security of sessions and documents. Yep. Maintaining the quality of the provider-client relationship. Yeah. Other, none. Okay. Yeah, that piece of maintaining the quality of the provider-client relationship. There are definitely clients on my caseload. Like I met them once, like we had an intake in February, and then the next thing we're all on video. And it's the strangest thing to have never met a client in person ever, or, in my experience with one of them, only having met them in person once with a couple of folks. Okay, let's see what people threw in the chat. Yep. So Tanya, getting started with telehealth can definitely be overwhelming. Yeah, Teresa, that's the hard one, right? So people contacting you from out of state who want to see you, and then there are all sorts of regulations around can we practice out of state? And there has been some relief due to COVID, and I know that the NASW in the last year has been strongly advocating for some sort of reciprocity around licensing so that we can continue to provide teletherapy across state lines. And again, it's dependent on state, right? Each state varies. Yeah. Okay. All right, so for folks who are just getting started with the teletherapy, the next few checklists will probably be super helpful. Okay, so first things first is our equipment and technology, right? So we definitely need to be using a HIPAA compliant video platform. And on one of the slides, I've got a list. But what, just to throw that out there, what are some platforms that you all have been using for teletherapy? I have been going between the free version of doxy.me and Google Meets through my Google Space, Google Workspace, there we go, Google Workspace that is HIPAA compliant. So Rebecca's been using Simple Practice. I've heard great things about Simple Practice as an EHR. I use Theranest. So Jennifer, Doxy. Yep, and there is a paid version of Doxy, but I've heard from folks that there's not much of a difference. Okay. Zoom for Health, yes. And I think a couple of weeks ago, because one of the holdups for people using Zoom was that it's like $200 a month. But I think a couple of weeks ago, Zoom changed their prices for therapists. But since again, I use my Google Workspace or Doxy, I didn't need to look into that too much. FaceTime, Zoom, yeah. Jennifer hasn't been doing teletherapy. Yeah. Okay. Also, Psychology Today. So if you have a profile on Psychology Today, they also have a video platform. I'm not sure how long ago it came out, but my psychiatrist uses the Psychology Today video platform. So I haven't had any issues, or there haven't been any delays, or it not work. So seems like that one's also a good one. So how can you be sure that it's HIPAA compliant, Robin asks. So one of the things that makes it HIPAA compliant is that you also have a business associate agreement. And one of these slides coming up, I'll talk a little bit more about what a BAA is. And so also thinking about like what platform you're using and are they saying that they are HIPAA compliant? So for example, FaceTime is not a HIPAA compliant platform to use because they don't offer a BAA, a business associate agreement. But one of the things that happened at the height of COVID for accessibility purposes, because not everyone has a computer, not everyone has access to Wi-Fi, there were policies lifted, or insurances actually were like, okay, it's fine, use FaceTime if you need to use FaceTime, if that's all that a prospective client has access to. So I know that that was lifted. The other thing to think about in terms of equipment and technology is like credit card processing, right? So before, when we were seeing folks in person, maybe they were giving you cash or checks, or you were swiping their card. How are you doing that now via teletherapy, right? You want to have access to your computer, PC, Mac, built-in or external camera. The piece around the external camera, I'm wondering how many of you, what you all have experienced around clients logging in and being on video or not being on video. I've definitely heard some interesting stories, right? Like, people coming on the video halfway, or just teenagers. I've heard from quite a bit of the therapists that I supervise, like some of the teenagers like being a bit shy in the beginning to get on video. So I'm not sure what you all have experienced. And again, feel free to add in the chat, like what are some of the things that you have experienced from doing video teletherapy? Of course, you want to make sure you've got a mic that works. A document camera, I've never used one of these, but it seems like a really cool tool because basically it's a camera that, right, any article or document, book chapter, right, you could put it under the camera and then it displays and you can share that. So I have found different ways to get around that. So for me, it's like if I have an article, I'll send it to a client, or if it's something from a book that I'm reading and there's a paragraph that I want to share, I might take a picture and just email it to the client. Sound machines, right? Internet. I know there have definitely been times where I've lost internet or it's gone in and out, or I think it was in November that I was out of electricity for like 3 days because whatever storm happened. So that was pretty frustrating. What else here? Okay. So here's a list of some of the video platforms. Spruce Health is another one. I tried using that one, but I was already paying for my Google Workspace. So I was like, let me just stick with that. Regroup, Blue Jeans, Theranest, again, that's the electronic health record that I use. Somebody had mentioned Simple Practice. Who was that? Rebecca. Therapy Notes, Counsel, other considerations. So for documents and email, because we want to make sure that we're sending things that they are encrypted and HIPAA compliant. So Intake Queue, Luxy is a way to make your email more HIPAA compliant. The other, so Intake Queue, it's an online form, ways to send your forms back and forth. The other one besides Intake Queue is Jotform. So what have people been using to receive documents, intake documents, any kind of documents from clients? And feel free to throw that in the chat. Let's see, at the time, creativity, oh yeah. Yeah, I think one of the things that has definitely come up in terms of doing teletherapy is creativity. And one of the things for me in that is also like a different way of sharing resources, right? So in a teletherapy session, I might send a client a YouTube video. I might send someone one of Kristen Neff's mindfulness, self-compassion videos, and we're doing that together in session. So I just think that there's so many ways to be creative. I know right in the beginning, through Facebook, I'm connected to quite a bit of Facebook groups. All of a sudden there was a whole Facebook group created for therapists who do play therapy. So trying to figure out how to do that with their young clients via teletherapy. So there's a lot of good resources that came out of that. Okay. And then again, so more of the teletherapy platforms, so Doxy, Zoom, Theralink, BC. BC was free, but then COVID, and then they upped their costs, so. Okay. So other things around adding to our checklist. So documents and paperwork, so license, right? So we have to be licensed in the client states, although, right? So with COVID, there has been some relief and it's been dependent based on state to state. And so just throwing in the chat, how many of you have clients that you're working with who are in other states? And what states are those? So Shoshana asked, okay, so Jennifer's only in Michigan. Shoshana asked about software is particularly good at disability accessibility. So I'm thinking, Shoshana, I'm not exactly sure. Some of the things I'm thinking about that would be helpful in making it accessible would be, right, live scripts. I don't know if we have the live script on right now. Do we? I think I asked.
It should be on. Yeah.
Perfect. I can't see it as a presenter, but good. So live script, also screen readers as well. Yep, so Diana, working with so many students in other states, the General Council, yep, that you could do this on a limited basis. Yep, a few that have come here from other states during travel or work. Yep. All the clients, so Rebecca, all my clients are in 2 states, Ohio and Michigan. Yeah, one of the interesting things, most of my clients ended up out of state. So I had one who moved to Texas. So I was able to continue to see them through COVID. One who moved to California that I could not see. I will say California has been the hardest one to navigate. I've got another person who moved to Illinois and was able to still see this person through COVID. And then another person who's in Indiana. So of all of my clients, I only lost one because of the out-of-state guidelines. Yeah. Okay. So the other thing you want to make sure that you have, coming back to the slides, is malpractice, liability insurance. So on the next slide, I'll talk a little bit, or in 2 slides from now, I'll talk a little bit more about the different types of liability insurances. You want to have your consent form for teletherapy. You want to have a payment policy, your HIPAA privacy form, your cancellation no-show policy, intake forms. Thinking about like the cancellation or no-show policy, Facebook in the beginning has been so entertaining to be on. So I'm gonna, again, as I mentioned earlier, a couple of Facebook groups of therapists across the country, and some of the stories that people shared of like getting no-showed and like knowing that like your home, right? Like kind of wondering why people are no-showing to teletherapy when it's so much more accessible. So that's been interesting. Our intake form. So I know one of the things that I had to scramble to do was convert all of my intake forms to PDF fillables, because what I would do, right, schedule a client, I would email them the intake forms, they would print them out and bring them to our first sessions. So early on, I had to scramble and pretty much convert all of our documents, all of our forms, our releases of informations to PDF fillables, and that definitely took some time. And then also trying to figure out like, okay, now how do I get these forms back in a way that is secure and HIPAA compliant, and I'll talk more about that in a second. Other things like therapeutic materials, so worksheets and handouts. So one of the interventions that I use for suicide and suicidal ideation, it's called the Collaborative Assessment for Management of Suicidality. It's called the CAMS. And they have a 4-session series, a 4-session document in tracking suicidal ideation, working with clients, because these also the very first document is one that client fills out. And so again, I had to scramble and convert all of those documents to PDF fillables and to be able to share. Let's see. Yeah, Shonda, it took time to convert paperwork to PDFs. Yes, it was a lot. So how I converted all of my docs to PDF fillable, I used Adobe to do that. online resources, so educational online games and websites. One of the therapists that I supervise is a video gamer, and interesting enough, like I really do think that there's a way that video gaming is going to become an intervention in therapy to be used therapeutically. There is a therapist who is also a gamer who does research on this, who's got a podcast. I can't remember her name off the top of my head, but she talks about how she uses video games with clients. And so, one of the therapists in my practice, he does use video games with clients. And it's so interesting. Another person that I supervise in our clinical supervision, Monday, today's Wednesday. On Monday, she was telling me how one of her new teen clients, like she noticed that he wasn't, he was kind of halfway in the video and she could hear noises in the background. And when she asked, like, are you playing? And he's like, yep, I'm gaming, but I promise I'm listening to everything that you're saying. I'm paying attention. And she did say that this was one of the better therapy sessions that they've had, because he really opened up. One of the articles that I read over this time was talking about how men have had to redefine friendships and relationships during this time of COVID, because we've been in quarantine and in isolation and have not had access to our communities or to like everyday things that we used to tap into. So this idea of men having to rethink their relationships with their guy friends, because most of their relationships are what's been called shoulder to shoulder. So like we're sitting next to each other and watching a game or watching something on TV. And right, we can't do that in this last year. We can't really engage in that way. So this idea of like, how do you translate this idea of like shoulder to shoulder through video, right? And this was kind of one of those ways of like this kid of like playing video games while conducting his therapy session, while being in therapy session. And the therapist was like, this was one of the better therapy sessions that I've had with this teenager, because he was so open in ways that I hadn't been before, right? We also think about for those of you that have like young people in your lives, children, nieces, nibblings, nephews, right? We tend to get a lot of information from young people in the car ride. And a lot of that has to do with there's no eye contact that's happening. And that's something that I have found really fascinating. So again, thinking about we're doing video therapy, eye contact is a conversation that comes up a lot. And how are we navigating that? Let's see, what do we got? Oh, okay, Kristen Neff. Oh yes, okay, Diana, I see. Yes, self-compassion videos, Kristen Neff. Her website is mindfulness is it just mindfulness.org? I think so. Yeah, I think that's it. I should know it off the top of my head. I hang out on that website so much. Let's see. So Randy is wondering how folks seeing primarily young children manage if the primary modality was play therapy. So yeah, if anybody wants to respond to Randy's question. Summer's talking about gamification of health and resilience. Oh yes, I'm excited to check out that website. Okay. All right, cool. Physical stimuli. Okay, yep. Flashcards, books, lots of good things happening there. Okay, let's see. All right, so liability insurance. So it's important to know the difference between the types of liability insurance, right? So your malpractice professional liability, this is the one that is pretty much required of all of us. General liability is more about bodily injury associated with medical costs, personal injury, damage to property. Cyber liability. So this one's an important one, and I don't know if all of us are aware of this one. So cyber liability is to protect us from digital data breaches, right? And so here it's first party and third party. So first party meaning I sent the email with protected health information to the wrong client. Like this is a first party breach. A third party breach is like, okay, someone hacked into Theranest or Simple Practice, right? Which is completely, totally out of my control. Some of our malpractice and professional liability insurances cover third party breaches. So that's something to check in about with your liability insurance. Does your malpractice or professional liability cover for third party breaches? Yes or no? If it doesn't, you might want to consider getting the cyber liability. I have yet to see any professional liability insurance that covers first party coverages. So again, like if you send protected health information to the wrong person. So I would look into that. Oh, Jennifer, you have a PLC and they would not let you get a cyber. Wow. Huh. I wonder if there are other insurances, liability insurances, Jennifer, that maybe more folks with PLCs use. Like I'm thinking CPH, I'm forgetting I'm forgetting the name of it, but I know CPH is another very popular liability insurance. So Robin asked, is general liability necessary if you're practicing teletherapy only? No, I would say if you are practicing at all, general liability is helpful and important. If you are working in an agency, you might want to check in with your agency to see if their general liability covers you as well. So I know when I worked at U of M's counseling center, I didn't have my own professional liability insurance because I was covered under the agency if anything came up. So a good question to ask the agency. All right, so some pieces about informed consent and what do we need in our informed consent. So logistics, right? So wanting to lay out the logistics of sessions for what's HIPAA compliant platforms, confidentiality. So thinking about how do you protect a client's confidentiality? I think with going to teletherapy, I feel like there's a lot of people who are navigating like privacy and confidentiality in their own homes, and some people having to do teletherapy from their cell phone in their car, or some people who don't have access to Wi-Fi in their home. So maybe they are parking like downtown outside of a coffee shop and using the Starbucks Wi-Fi. People are doing that. I know one of the things that we ran into, we had a teenager who felt like parents were listening in during his therapy session. So one of the things that we offered this young person is the way that our office is set up. One of our office locations, the way it's set up, it's individual suites. So one of the things that we did for this person, we gave this person access to one room, said like, bring your laptop, here's the Wi-Fi stuff. You go sit in this room and your therapist is 2 doors down doing teletherapy from that office. So that was one of the ways that we had to get creative because definitely this is a person who wanted to be in therapy, was engaged in therapy, but also felt like couldn't be super honest because felt like parents were listening in. So, there's just so much need to be creative during this time. And I just want to say more about that because like what people are doing to access therapy right now. It's pretty brave and brilliant. So again, practicing, coming back to number 3 on the slide, right? Needing to be licensed in your state. Connectivity, right? So if your Wi-Fi goes out or the client's Wi-Fi go out, is the protocol then to hop on the phone, right? So my therapist we were using Doxy, and then when Doxy was no good, we would do FaceTime. And I knew the risk of FaceTime. It's not HIPAA compliant. It's not necessarily confidential for whatever the technology reasons are for that. But I, in the informed consent, knew that. And I was fine with that. For payment, again, how are you getting payment from your client? Cancellation policy. What is that? Did any of your cancellation policies change with having to go into teletherapy? So yeah, I'm very curious about that. For those of you with cancellation policies, did anything change in your policy when you went into teletherapy? And you could just throw that in the chat. So emergencies, so no, so Elizabeth's saying no, nothing changed about the policy. No changes. Policy got more lax. Okay. Yeah, I'm thinking to like this Facebook group and this one therapist did relax their no-show policies and later regretted it because got a lot of no-shows, which I mean makes sense to me, right? Like we are all living in this global pandemic. I think for many of us, hitting our walls at different points, mental health exacerbating. I will definitely say we have definitely seen an increase in people looking for services. Okay. Alicia, welcome back. So emergencies, right? So here's one of the things that I was reading early on in COVID, and why people have been anti-teletherapy up until we all had to do teletherapy, because it's been the only option really, is that the fear and risk of clients with expressing suicidal ideation. And I read a lot of articles because I taught a whole mini course on this last May of like, okay, why are we so anti teletherapy? Because we're worried about clients with suicidal ideation who are expressing suicidal ideation. And literally in all of these articles that we read, that my students and I read, the only reason we could find for why not to do this was because of liability and risk issues to the individual therapist. So more of for a CYA, just don't. And what I have found is like even more reason to provide teletherapy and to see clients who are expressing suicidal ideation, because it's important for them to have access to therapy and resources. I was pretty floored learning all of that through the articles, that really the only reason was like CYA is a reason not to see clients via teletherapy who express suicidal ideation. Yeah. I know that hopefully, I love the CAMS model, the suicide intervention that I talked about before, the collaborative assessment for managing suicide. I think once I got trained on that back in, I think it was 2013, I have not been afraid as a therapist, as a mental health provider, to talk about suicide with clients. I know that many providers are, because it is a scary thing to think about. But at the end of the day, their suicidal ideation is a common thing. I don't think we talk about it enough. So coming back to number 7, right, in case of an emergency, it's important, right, and part of the informed consent to always ask the client their location, for you to always have the phone number of the local emergency room or police department. One of the things that I've learned about Ann Arbor Police Department is that whenever there is a call and there is suspicion of mental health, they will call the community mental health agency, because they have a whole mobile unit that comes out alongside with them. So I think that that's something important to know. Like, does the police department in your community also have that resource? Do they access that resource? Is there some advocacy that needs to happen around that being a resource? Yep. So one of the things, when I have seen clients via teletherapy and I confirm their location, for some of my clients who are in their car, in their parking lot, I will ask them, okay, what's the color of your car? What's the license plate? What 2 cars are next to you? So if I have to send someone out, and it's not just if I have to send someone out because of suicidal ideation, it's also like, do I have to send someone out because you have passed out for whatever reason, right? Like, there's lots of reasons why we might need to get help to our client. So I always ask, like, okay, again, what's your car make, model, color, license plate, and what are the 2 cars that are next to you? So that if I need to call for help, I've got as much details as possible to share. And then consent, again, right? Getting consent from our clients. Okay, we've got a poll. How long have you been providing teletherapy?
All right, going to give you guys a couple more seconds.
Okay. All right. So it sounds like the majority of folks haven't had a first session, still figuring it out. 1 to 3 months, and 1 to 5 years is the next. I should have broken down that 1 to 5 years to maybe like 1 and then 2, 3, 4. Yeah. Okay. All right. So the next 2 slides, I'm going to talk a little bit more about like pros and cons of providing teletherapy for providers and for clients. But I want to hear first from all of you who have been doing teletherapy, or even if you haven't, like thinking about what could be some pros and cons for the doing therapy through teletherapy. So go ahead and put some answers in the chat. What have been some challenges? What have been some good things about offering teletherapy? And again, for those of you who haven't, what are some things that you could think of that could be pros and cons? So time. So Enos, are you saying time is like having more time? Accessibility, yep. Flexibility. Yeah, Amy, yes, reaching people in isolated areas, pro access to therapists. Yep, Bridget, so some people feeling more comfortable in their own homes. Privacy issues are also like a con, yep. Waning commitment from the client. The shifting regulations, yep. Yep, the connectivity can be a challenge. The internet going in and out, kids coming in and out, yep. I've learned a lot about headboards. Yes, meeting people's pets has definitely been a pro. Yeah, people don't have to cancel when they have a sick kid home from school. Yeah. Confidentiality. People have been better about keeping remote versus in-person meetings this past year. Yep, reaching rural clients. Yeah. Yeah, definitely all of those. Comfort, relaxation. Worries about the cons, worries about insurance stopping coverage. Yes, yes. Oh, yeah. Yeah, that has been a stressful one. I know when we went to teletherapy, I outsource billing and insurance verifications to a whole other company. That's amazing. If you need a good billing team, I have the best recommendation ever. My person's great. Yes. So when we went to teletherapy, we got an email from the owner of the billing company saying, like, it is not humanly possible for us to re-verify all of your clients to see whether they have teletherapy as an option or not. Thankfully, I know how to do insurance verification, so I was glued to my computer for like 2 weeks trying to figure out which of our clients had teletherapy coverage. The headache with that, though, was insurance companies were scrambling to update what the heck they were doing, if they were offering teletherapy, if they were charging for that, how are they doing that? So, some of the information that I found in my insurance verification process was current and some was not. I think it was maybe mid-April when a couple of insurance companies in Michigan said, okay, we're covering teletherapy until September or July or last day of June. So that was helpful. But also, one of the things I did ask Cindy, who's the owner of the billing company that I use, was like, she suspects that down the road, perhaps when we are able to go back in person, that she suspects that insurance companies will reimburse less for teletherapy down the road, which I would hate for that to be the case. Yeah, so Diana, better access better access for clients who aren't functioning well. Yep, need specialists that aren't in their area. The cons, yep, navigating the technology and lost time due to that. The confusion around out-of-state issues. Oh, people doing a session without their shirt on, awkward. Yes, I'm so curious to hear like what stories have you experienced? I know one of my friends who's a therapist told me like one of her clients showed up with a whole glass of wine. And my friend was like, we're not a happy hour friend, like not friend, but we're not a happy hour client. Like we're not doing that. So it's been interesting to see like what boundaries are being crossed, right? Like I had a client who like vapes in the middle of session, and the first time that happened, like I really was stunned and I didn't say anything because I was shocked. I was like, is this good? What's vaping? What's in there? Oh my God. 2 weeks ago, I had a client get up to close the door of their bedroom, and they were in their boxer briefs, and I don't think they knew that they were in their boxer briefs and didn't even, so I didn't say anything because it's not like, I didn't get the vibe that this was intentional or on purpose. Like, I really just think they forgot and they got up to close the door, and that was that. Because this person didn't even flinch or like say anything like, oh my God, I'm so sorry. Nope. So it has been awkward sometimes for sure. Oh my gosh, your client took the therapist into the bathroom, hit the bong before session and put me, oh, yep. Yeah. Yes, Michelle, definitely some good ground rules should be discussed for sure. And I will definitely say, when I first started with teletherapy, I was not thinking about ground rules because I would never expect someone to show up to therapy with a glass of wine or vaping in the middle of session. So yeah, I think the understanding of ground rules came much later. Okay, so I'm just gonna go put this up very quickly because pretty much you all have got this. Yep. Oh, yeah, that one down here of like interruptions of sessions, like dogs barking or kids. Yeah, yeah. And then for clients, yeah, and these are all things that you have talked about and have thrown in the chat. Yeah, I love teletherapy. I love the access because, right, so for myself, like, okay, therapy is 45, 50 minutes, but I have to leave work to get there and then I have to commute back. So really I'm taking an hour and a half, if not more, to get to therapy. So being able to do it online has just been so incredibly helpful. Okay, so some legal stuff around HIPAA. I'm so excited. We've been so chatty, even though like I can't see your fabulous faces. I love that we still get to engage. Brenda, you've been doing home visits for 5. You can top all. Oh my gosh. I'm sure you've got stories. Okay, one more. We talked about this a little bit, but how many of you, so we're going to put another poll up here. Yeah. So let's see, so 90% of us are only in Michigan, 5% another state, 2% 2+ states or countries, 2% of us not currently licensed. Yeah. So Elizabeth, you're only licensed in New Jersey. Are you seeing clients in New Jersey right now, Elizabeth? Yeah, I'm only licensed in Michigan, but I've definitely considered and have looked into getting licensed in Texas, which is my home state, although I don't think I could call it my home state anymore because I've been in Michigan for 11 years. But I feel like that's still home. So yeah, so Elizabeth, yeah, you are still seeing folks in New Jersey via telehealth. Okay, Beatrice, Georgia, and Tennessee. Yeah. Rebecca, Ohio and Michigan. Okay. Yeah, one of the things for me as I look into getting licensed in Texas is that I have to take a whole other test on like Texas law. So I got to study for that, and my brain is not in a studying place these days. So that's probably not going to happen anytime soon. All right. Okay, so keeping it moving here. So in 2016, this is when Michigan's telehealth law started to require patient consent. So I'll just leave that there. Just know that that came about in 2016. So I think it's interesting, you know, that article published in the Time magazine in 1992 about teletherapy, telemedicine, and in 1992, and here we are in 2016 or 2016 at the time of this law, thinking about consent and what are the rules. Okay, so some piece around HIPAA. The one I'll talk a little bit more about. So we've got our privacy rules around protected health information, right? This is part of our informed consent, letting our clients know like when we can and cannot break confidentiality. The one I want to talk about more is the breach notification, because not many of us know about the details of this one too much. Let me scroll through my notes here. So this one, so that second bullet point, so this also comes back to the cyber liability piece, because what the law says is that under the breach notification, if it affects 500 or more people, or fewer than 500, depends on how we need to report that. So that's just the one thing I want y'all to think about, that when there is a breach, there are rules around who we have to tell, when we have to tell, how soon do we have to communicate that to someone as well. So I'm going to leave that there. And then the business associate agreement. So with anyone that you are contracting through your practice, it's important to have a business associate agreement. So this is an agreement basically saying that both of you are tending to the fact that there's protected health information, and there's an understanding and agreement that protected health information will be taken care of and will be thought about and will comply with HIPAA regulations. So you would want to have a business associate agreement with like Square, if you use Square or Ivy Pay, or your electronic health record, whether that's Simple Practice or Theranost, any of them, with your Google Workspace. If you use Doxy, you would want to make sure you have a BAA on file, your own copy. Okay. So HIPAA during COVID, so the Office of Civil Rights, back at the height of COVID early on, they did allow more flexibility for HIPAA compliance. So mostly that came in the format of like, use FaceTime, use Skype, that's fine, right? Like, we don't want to deter people's access to therapy because of HIPAA, but you also have to do this in good faith. And good faith meaning that through this, like, you're not committing another crime, you're not using people's identity for other purposes, that you're not accessing people in this way to, again, commit a whole nother crime. And that it is for the purpose of teletherapy, that there is consent, that there is informed consent between, again, the client is aware of all of the informed consent. So with that, so just this slide is just saying that, again, FaceTime and Skype were like, okay, you can use these. So some pieces around our code of ethics. So getting into our code of ethics. Let's see, how am I doing on time? Okay, I might skip some things so we can get to more chattiness. Okay, so our ethical principles, right? We've got service, social justice, dignity and worth of the person, importance of human relationships and integrity. So this is what our the principles of our code of ethics say, and our ethical standards, our responsibilities to clients, colleagues, our practice settings, our ethical responsibilities as professionals, to the social work profession in general, and then to the broader society. So again, right around the height of COVID, there was this lovely article posted by, I think it came from the NASW, ethical considerations during COVID. So let's see. I'm going to go through those. So providing essential services is part of our code of ethics, right? If you can provide appropriate professional services, we should. Practicing self-care. So this is a big one. I think it wasn't until maybe 4 years ago. So I know in grad school, we spent a lot of time talking about self-care and self-care and self-care. Somehow in grad school, I didn't make the connection that self-care was actually in our code of ethics. And that didn't click for me until maybe like 4 or 5 years ago when I went to a CEU that was specifically talking about self-care and this code of ethic, this 4.05 on impairment, right? That social workers should not allow our own personal problems, psychosocial distress, legal problems, substance use, mental health interfere with our professional judgment. You know, here's the thing, right? Like, we are also living in a global pandemic. And, you know, one of the things that I feel like maybe I've just started reading in the last like 6 months are articles about mental health providers during this time of COVID. Like, I'm now starting to read articles with the headlines of like, you know, who's taking care of the mental health providers, right? As I have definitely seen an increase in people seeking services. And I don't know if that's been true for you as well, or the agencies that you work at. But this piece around self-care is so critical. I know, and you know, for me, like, I definitely hit my wall in March, and it's been a struggle for me for the last 6 weeks. And so I've definitely had to like really kind of practice a lot of self-compassion, that I'm not thriving the way I was last year. And trying to balance like self-compassion with like, okay, so self-compassion and like, what's the behavior activation that I need to do and the self-care stuff that I need to do, because I finally hit my wall. So, you know, just to throw this out to all of you, what are some of the things that you have been doing for self-care? I took a week off in March. Like, I was like, clients, sorry, I can't see you. I do clinical supervision of LMSWs. I was like, I've got nothing for you, y'all. I need to be gone I just need to be out of this office for a week. So I did that. What about for you? And feel free to throw it in the chat. Yes, exercise, walks. Yeah, meditation. I will say the other thing, again, last year at the height of COVID, the Facebook groups that I was a part of was with other therapists across the country was so helpful. But in January, after witnessing what happened at the Capitol, I have not been on social media since then. So it used to be helpful, and I haven't been able to be on social media since then. Reading, bike rides, yoga before bed, referring out instead of taking more clients. Yeah, playing. Yeah. Functioning at 80% most days. Flexibility, yep. Day of rest, yeah, from spouse and children. Massage therapist, yep. Tanya, yes. Going to see your husband who's overseas. Some of us got sick with COVID. Jennifer, yeah, the having kids at home and the remote learning. I mean, there's just been so many articles about the changing workforce because women taking on a large part of the remote learning and supporting their kids during remote learning. Yeah. Cry in the car. Yes. Oh my God. Yes. I love crying. I do that too. Hikes in the woods. Yeah, Shoshana, there's something about crying in the car. I find myself like crying really good in the car. Yep, reading fiction, using fidgets. Look, I've got, yep, gotcha. What else? Napping, water. Yep, a lot of mindfulness and yoga. Trigger self-care cards. Ooh, that sounds awesome, Jennifer. Oh, I like that. Yep, Amanda stopped using Facebook. So did I. I don't even have Facebook or Instagram on my phone anymore. When I took the week off, I went and stayed in a hotel in Detroit because I'm like, I can't stay in my house either. Like, it's too much. And I, instead of like taking time to delete apps and taking email off my phone, I reset my entire cell phone. I just deleted everything. And most of the apps did not make it back on my phone. And email, I no longer have any of my work email on my phone. Writing about my anxieties before bed. Yeah. Watch the sunset by the water. Yeah. Tanya, are we emailed the slide? No, we won't be emailed the slides for this presentation, but perhaps there's something that I could share. So I'll think about that and connect with Emma about that. I feel like we could do a whole, I hear you, Jennifer, I need the slides. I feel like we could do a whole other CEU, like the one I attended around like understanding that self-care is an ethical obligation. So the other ones that the article talked about, so being client-oriented, commitment to the client, right? If there is an interruption of service, and this one specifically talks about the technology piece, what's the plan? Oh, Tanya, okay, the checklist is helpful. Okay, I could definitely get that to you for sure. Practicing cultural humility, right? Cultural awareness and social diversity, like, gosh, what we know in this last year, right? The murder of George Floyd, right? The ruling that came down a couple of weeks ago, the increase in anti-Asian discrimination and racism that we've seen in the last year, needing to be aware, right, that for many of our clients who hold marginalized identities, the environment, right, this, as social workers thinking about systems, right, and systemic oppression, like this is impacting people's mental health. I feel like we are talking a lot more about racial trauma, racialized trauma. I think I read an article a while back about like public health officials are officially saying that racial trauma is officially a public health issue. So needing to think about that, right? And how is all of this affecting our clients? Continue to learn, right? Our competence always continuing to learn is important. More competence around the use of technology. And informed consent. So how do we get information about informed consent with our clients? And then the last two, right, privacy and confidentiality, again, through electronic communication. Okay. So let's see, we're 314. I always over prepare. So I've got like 4 cases, but we won't be able to do breakout rooms, but I think that we could do this out loud together in our chat. So, so when we are thinking about ethical dilemmas, right? Ethical dilemmas come from the fact that we have a judgment about it. We have a value connected to whatever the dilemma is. And this is why we have, ethical decision-making models, right? Like, we're human, we have various lived experiences, and of course, it's going to impact how we do our work. So when we're thinking about making an ethical decision, right? These are the 6 things that we need to think about, right? Determining whether there is an ethical issue, identifying the key values and principles involved. So not just the key values and principles that our code of ethics tells us, but also what are your values, okay? So, and this is where the conflict comes. This is why there's an ethical decision to be made, because perhaps our values are in conflict with what we have been taught and trained the code of ethics values and principles are. So one way to think about that is ranking the values and ethical principles, developing an action plan, implementing your plan, reflecting on the outcome. So let me go to the next slide, because yes, I like the next slide better. So this one, it's a ethical decision-making model. It's ethics A. And so I love it because it's just a quick, easy thing to remember, right? So examine the situation, think about the ethical principles and standards, hypothesize possible options, decisions, identify the consequences of each of the possible options, consult is so huge. More than one brain thinking about this is better. Selecting what is the most ethical action and advocating for change. So let's see. Okay, so let's check this case out. So I'm going to give you a second to read through that. And then I'll prompt us with the questions at the bottom. So Janice. You're welcome, Janice. Okay, so in this case, so we've got Dr. Vader, who has started their private practice. They've got a business plan. It's all internet-based, teletherapy-based. They are now seeing clients from all over the world. What are some important ethical, legal, and clinical issues in this case? So feel free to throw that in the chat. Okay, Shoshana, so first, email is not considered confidential. Okay. Could be a huge, HIPAA compliance. Yes, Gabrielle, paying in advance for services. You know what? I have heard more private practice clinicians doing this. It's interesting. It's an interesting practice. I have heard, yep. It is an interesting practice for sure. Paying in advance for services. Yep. So using Skype is a no. Keeping track of so many clients. Yep. all over world license. Advanced payment being unethical. Is PayPal an accepted HIPAA tool? Depends if PayPal allows and has a BAA. I know I use Square, and Square does have a business associate agreement. A lot of therapists also use IV Pay because IV Pay was specifically created for therapists. Yep. Yep, Alicia. What about people who can't pay up front? It's an access to care issue. $25 per email. Mm-hmm. Yep. Yep. So all of the things that you're talking about, right? So do they have competence in telemental health? Do they have competence around like use of technology, multicultural competence, right? Like how is it that you're seeing people from all over the world? Again, I don't think there's a license to work anywhere in the world. I know I have seen on some of my Facebook groups when I was on the social media, people wondering like, okay, like how do I see clients overseas? And there's no one easy answer. There's a lot of research that goes into that. Yep, so Rebecca's saying using standard informed consent, which wouldn't be covering the unique dynamics of this design system, right? Yeah. 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 Anything else? I think you all really got to the gist of them. Email seems very inappropriate. Needs may be urgent. Right. Yeah, Randy, you know, the other thing I'm thinking about and the time differences, right? Like, are you doing teletherapy at 2 a.m. your time and like 10 a.m. somebody else's time or 2 p.m. somebody else's time? Like, how does that impact your self-care? Like if you're a night owl, I'm sure that's great. But again, then there's the other pieces around being licensed. I did an internship in Costa Rica for like three months when I was a grad student. And one of the things I learned about in Latin America is that social workers don't provide therapy in Latin America. Social workers do things like case management, working in child protective services, but social workers do not provide therapy in Latin America. So, right, like are social workers in other countries allowed to provide therapy, right? Like different professions. Yeah, the piece of, right, so if a client abroad is in crisis, like do they have access to 24-hour hotlines? Are those a thing? Is that a thing where this person lives? Who do they connect with, or what resources do they have accessible to them when they are in crisis if the therapist isn't available? What are the therapist guidelines for like when you can and can't contact me, right? Like if my work hours are 9 to 5 and you know my daytime is someone's nighttime, like how does that work, right? Am I having clients who are messaging me at 2 a.m. because it's 10 a.m. their time? What are the guidelines around that? Okay, so we got 324. So I'm going to skip ahead to a few other slides. So I had a few other cases. So recommendations, some final recommendations as we wrap up here. So taking reasonable actions to use all readily available technology to protect the client's confidentiality as much as possible. Use, even though legally we are allowed during this COVID time to use like FaceTime and Skype, like as much as possible, stick to what's HIPAA compliant. Of course, accessibility is important, so something to consider. right? Only providing clinical services to that you are competent in, right? That you are trained, that you have relevant clinical experience, right? Sticking with your scope of practice, developing your technology awareness and competence around the use of technology, multicultural competence, right? Understanding how like systemic oppression impacts our clients. There we go. Following all requirements for ethical conduct of your code of ethics. So becoming familiar with relevant telemental health practices, right? So we know in Michigan as of 2016, clients we're required to get informed consent from our clients. Learning if we can practice across state lines, and that's always going to be coming from that state's board, whether we can or can't practice or what the rules are on there. Using an informed comprehensive informed consent process. And then, yes, so last one here. Here's the other one we didn't spend too much time on, but learning about and following all duties to warn in mandatory reporting. So here's one thing I've learned. What's mandatory reporting here in Michigan is not necessarily mandatory reporting in other states. So I have found that to be an interesting thing that I learned. It's like, oh wait, California, you don't have to report this? Okay, this is interesting. So again, you can't bank on the state that you're licensed in and the laws that are in your state. You can't assume that those laws are the same in other states that you may be practicing in. So again, if you are practicing in another state, like it's important to know what mandatory reporting looks like and what resources are available in those states as well. Documenting all teletherapy services, right? Start and end time of sessions. Some insurances require that. Utilizing an ethical decision-making model and maintaining appropriate liability and insurance. Okay, so let's see. And then we've got some resources here. And we have a few minutes left. I know that some of y'all will be joining the reception from 4 to 5 and that there will be breakout rooms there, but I will definitely say of this list of resources, the one that I keep coming back to over and over is the second book on the list, Trauma Stewardship. So it was published in 2009. And that is the book that I continue to come back to over and over. Yes, Mary Ann, you want the name. So the name of my billing company, it's called Healthcare Connect, and they're out of Canton. And I think that they have let go of their website because when I look for it, it's not there anymore. But Mary Ann, I'm going to put my email address here. And if you email me, I could give you the contact information because I feel like it's almost a rite of passage to have a bad billing experience, which I did. So finding a good biller is everything. Oh, Shonda, okay, clinical to macro. Yes. All right. Thank you all so much for joining me today. I love being able to connect with folks. And Emma, I don't know if you had any last things to share or announce?
Not really, just thank you to everyone for joining us. I'm going to put the continuing education email in the chat. So if you guys have any questions about your CEUs, when you will receive them, if you don't receive your evaluation, please email the Office of Continuing Education. If you email my office directly, I am just going to pass you over to them because the Office of Development and Alumni Relations does not distribute CEUs. The other thing is I did put the Zoom link and passcode for our closing reception in there. If you registered for the conference, you all should have also received an email about a half hour ago with that Zoom information. In that reception, you'll have the ability to talk with others who've attended these sessions. I know Liz and some of the other presenters will be there as well. So if you have any other questions, please bring them to the reception. And then last but certainly not least, you guys will receive recordings for these. And I'll work with Liz. So if there's any specific resources that you want from her, please send her an email and we'll work on getting that stuff for you. But I think that's it.
Awesome. Thank you.